This is for second year acupuncture students looking at treatment planning and specifically how to draw a diagram. Remember, this is for Chinese medicine students only. Please pause and read this. We'll look at a case and we'll look at how we fit the different bits of the diagram together. For example, we're going to use Sam, age 43, female. She's got migraines for the past 5 years. They're one-sided pounding headaches on the gallbladder channel. They're worse with stress and worse premenstrually, so sounding like liver yang rising, but better for lying down, so there's some deficiency going on as well, and better in the dark. They come with nausea, sometimes with vomiting, and preceded by a visual aura. Colours blue, sound groaning, emotion is fear and anxiety, and odour is putrid. But there is some green. Lots of signs of liver yin and blood deficiency, so we've got postural dizziness, tiredness, especially post-menstrually, floaters, occasional cramps, eyes somewhat red and easily tired, gritty, dry, some night sweats, damp heat or kidney yin deficiency, dry skin and hair, prone to anxiety. We also have some spleen qi deficiency, opening bowels regularly with loose, and the diet is lots of convenience foods and often missing breakfast. Work is quite stressful and also long hours. Prone to a dull, achy back, so more kidney deficiency. Some premenstrual, what looks like liver qi stagnation, possibly with some blood deficiency. Tearful, irritable, tender breasts, and the periods are quite irregular, and quite a lot of alcohol being drunk. And the pulse backs up the underlying yin deficiency with some empty heat or yang rising, liver, some kidney deficiency, red with a peel coat, kidney deficiency, orangey sides, so some blood deficiency, and quivering spleen qi shu with thin, so quite severe yin deficiency. So syndromes, first of all, go into square boxes. We need supporting signs and symptoms for each syndrome that we put down, and we need the most likely or significant differentiation. So for migraine, we might have liver fire, liver yang rising, liver yin or blood deficiency, stomach fire or stomach phlegm fire, liver wind, different types of migraine. What looks like here is liver yang rising and liver yin and blood deficiency. Our diagram to show us as much as possible. So for now, we don't use combined syndromes. We have all the syndromes listed separately with their symptoms, so we can see as clearly as possible. And historical but relevant syndromes can be included, but we put them in a dashed line box, like so. Here are the syndromes that we have so far. Symptoms we list next to or inside our syndromes. So for the element, this is going to include colour, sound, emotion, odour. We want all of our symptoms to be precise and detailed. We want to assign every single one of them to a box, or if we don't have anywhere to put them, we'll list them separately so that we can question more later on. If we have a Western medicine disease, we'll break it down into its symptoms. So for example, asthma, we might have a cough, tight chest, shortness of breath, and we'll put those symptoms where they belong, with asthma in brackets. Symptoms that fit into several syndromes, we'll put the one nearest the Ben, and we'll talk about that later. Conditions or symptoms, whether they're Western medicine ones or TCM ones, are not syndromes, they're listed in syndromes. So we don't have boxes for high blood pressure or running piglet qi, we put them inside syndromes. Historical symptoms are going to be discussed in the treatment strategy, but not in the diagram. And intermittent symptoms, so things like PMS, hay fever, migraines, we will include them on the diagram, but with some note to say that they're intermittent, or it will be obvious from the symptoms. So this is the syndromes with the symptoms fitted in that we have so far. Note that the migraines that are better for lying down are in liver yin deficiency and not in liver blood deficiency, because that's going to be nearer to the Ben. So we'll look at that now. Ben is root, Biao is branch. So Ben is aetiology, Biao is pathology. Ben is the upright, Biao is the unhealthy, the pathogenic factor. The initial or original syndrome, or the original condition or symptom, is the Ben, and later ones are the Biao. So the earlier something occurred, the more the Ben it is. The Ben tends to be the chronic, and the Biao is the acute in things like hay fever and colds. We've got our syndromes, we need to join them up. So connections, the arrows always go from Ben to Biao in one direction, and we'll know this because of the chronology when it occurred, Ben and Biao. Both directions only if we're really not sure. We can use bolder, thinner lines, or solid and dashed lines if we want to go two ways and prioritise, and I'll show you how that works. And if they're less relevant, we can use thinner or dashed lines. Mother-child should only go from the element to the child syndromes. So the Ben is the water imbalance, and this is leading to a tendency to kidney yin deficiency, and this is leading to liver yang rising. So that's our main thing that's going on. The kidney yin deficiency also leads or predisposes to some liver yin deficiency, and to some degree the liver yin deficiency drains the kidneys. The kidneys are the source of the yin, but we've got a solid line here and a dashed line here to show that this is the priority. We've also got a separate Ben here, which is spleen qi deficiency, which is aggravating the liver blood deficiency, although there is some interplay between these. So we've got a double arrow here, and the blood deficiency is also predisposing to some liver qi stagnation. We could also put some mother-child arrows in here, but I'm starting to get very messy. I don't like it. Next is etiology, the causes of disease, and these go into these oval boxes and they point towards one or more of the syndromes. So we want to be precise with this. So rather than saying diet, or even rather than saying cold food, we want to say eating too much ice cream. So make it as specific as we can be, and then our advice and monitoring can be more specific. Generally speaking, the elemental imbalance will be the deepest Ben. If the mother's sick, the child screams. We have the mother-child. Deficiency of one organ can easily drain another. So if there's heart blood deficiency, it will drain the liver blood. If there's spleen yang deficiency, it will drain the kidney yang, and so on. We also know that yin deficiency leads to empty heat, spleen qi deficiency leads to damp, yang deficiency leads to cold, stagnation leads to heat, damp heat leads to phlegm, etc. So these are things that we know about pathology. If there's wei qi deficiency, then we're more prone to external pathogenic factors. If there are external pathogenic factors, we can get stagnation of qi and blood, especially in the joints, and repeated external pathogenic factors can weaken an organ. So, for example, repeated wind cold can damage the lung qi. And these can also become lingering or latent. Men are more prone to Jing deficiency and Yang deficiency. Women are more prone to blood deficiency and Yin deficiency. And long-term conditions tend to deplete the kidneys. Etiologies that we know about: overwork and working long hours will deplete the kidney yin. We could have that going into liver yin as well if we wanted. The poor diet and the junk food will be aggravating, leading to the spleen Qi deficiency and the liver blood deficiency. Alcohol will be increasing the liver yang rising and the liver Qi stagnation, and the stressful work will be aggravating the liver Qi stagnation and the liver yang rising. This is particularly important because it gives us a kind of separate Ben. So this is very clearly defined progress of disease. This is a separate thing, so we may well need to sort this out. So now we just need to add any blocks. We might tap for AE, probably not anything else in this case, and then we've finished our diagram and we just need to go on to treatment principles. So first we're going to list, simplify and prioritise our treatment principles. Then we'll consider the current progress, we'll consider the presentation on the day, and then we'll plan our treatment for that day, which is usually 1 to 3 treatment principles. So list, obviously we just list them all out from the syndromes. Simplify, we eliminate any unnecessary ones. And prioritise, put them in order of importance. So for the water imbalance, we have test or treat the water CF. Kidney yin deficiency, nourish kidney yin. For liver yin deficiency, nourish liver yin, clear empty heat. Liver blood deficiency, nourish the liver blood. For liver yang rising, we have subdue yang, tonify liver and kidney yin, or nourish liver blood. For the liver Qi stagnation, we have disperse the liver, regulate the Qi. And for spleen Qi deficiency, we have tonify the spleen Qi. To simplify, we can get rid of nourish liver yin because we're going to do this by nourishing the kidney yin. No signs of empty heat, so we can clear that. Nourishing the liver blood, we might need to do that post-menstrually. Tonifying liver and kidney yin or liver blood, well that's in already, so we can get rid of that. Disperse the liver and regulate Qi, we may need to do that pre-menstrually. It's repeated, so we can get rid of one of these. And tonify the spleen Qi, we might need to do that via the diet for that separate Ben. Prioritising treatment principles, so first of all, testing or treating the water CF. So we would probably start with source points, kidney 3, bladder 64. We might use tonification points. Nourishing kidney yin and staying on the element, we could use points like kidney 3, 9, 10, bladder 23. If some comes in during a migraine or at a time when a migraine is likely to happen, the pulses show that there's more of a full condition, we might need to subdue liver yang. So points like liver 3, gallbladder 34, large intestine 4, gallbladder 20, do 20, local points, triple burner 5, points like that. So that's our main treatment principles. Once we're sure of the CF, we might choose points to nourish kidney yin that are off the CF. So we might bring in points like spleen 6, Ren 4, tonified. That we might need to consider are nourishing liver blood post-menstrually, regulating liver Qi pre-menstrually if the PMS is quite bad, and tonifying the spleen Qi, which probably do with dietary advice initially, but we might need to come back and treat it. That gives you a simple case of how to diagnose, build a diagram, put in your etiologies, and then do some basic treatment planning.